This is 423. Oh. Mhm. Why is this light blinking? Mhm. Are you ready? What is it? This light is off now. You should get more connections. More, and this connection, it's no way you can use Bluetooth to connect it without wires. Technology has gotten to that level now. Is it how wires flow in all those tech this thing when they are doing their mm. So you can't do wireless. Hide what? That one there. Oh no. But is it not bright? Why? That's to do that one that exactly. This one. Can we start this? Huh? You want to show them a video? All right, so good afternoon, everyone, and I'm glad to be back again with you this afternoon. We shall be having some interactions on fertility issues. I want to believe that a lot of you were present for the last one. We are going to still be looking at those issues that we looked at last time because of the questions that came up and all of the follow-ups and the feedbacks that we got. All right, so we'll be looking at all of those topical issues. My name remains Dr. John Abebe, the medical director of Joje Abebe Fertility Center and the president of the Joje Abebe Arts Foundation. All right, so we'll start by looking at the burden of infertility. Um, the the practice of infertility has showed us the tremendous burden that a lot of couples have to go through while on this journey to achieving their heart desires. And we work assiduously to ensure that this burden is reduced as much as possible. But of course, there are a lot of factors that are militating against the effective reduction of this burden. It's important for us to know that 15% of all couples will have issues, will have difficulty achieving conception. And we're talking about 48.5 million couples around the world that will experience difficulty in achieving conception. Now, in Nigeria and the sub-Saharan African regions, this incidence is a bit higher. We're talking about between 20 and 25%. And so you will understand, particularly in this part of the world, why it's a very serious burden because it remains one of the primary reasons for divorce among couples. We've seen a lot of couples who have come and their marriages are in tatters or are at the brink of collapse simply because there is no child. And for us in this part of the world, we place a lot of premium on the presence of a child in a home. And so if a couple gets married and they're not able to achieve conception, then it becomes a serious matter. In fact, what usually happens is that once a couple gets married, everybody expects that couple to just start having kids. 3 months after marriage, they start looking at the tummy of the woman. Is it bulging? In fact, on the day of the marriage, the prayer is that 9 months from that day, we shall come and dedicate a child. So they already put that couple on a race. And so it's always very, very disheartening when you now realize that the only reason why a marriage did not work is because they were unable to have children. Next slide. So, still talking about the burden of infertility, psychiatric psychological disorders is very, very prevalent amongst these categories of people. Up to 60% of change, but we are doing all we can to ensure that we are able to handle these burden. A very important question to ask is, who is to blame for our infertility? Before now, usually we see the women come forward to the fertility clinic, and they are the ones you see often. Why the men will stay back? And when you ask the woman, where is your husband? He said, well, my husband is at work, he's at home. He said I should go. What does that imply? It implies that in our culture, a lot of people feel that the woman is to blame when a couple is unable to achieve conception. But that is changing now. There seem to be this understanding that it takes two to tango. That when a couple is not able to achieve conception, then it has to do with either the male or the female. So you're seeing the couple come into the clinic as against what it was before. So before we go on to looking at who is to blame, well, I won't say who is to blame. I'll say that what are the causes of infertility? It's important to understand what infertility is in the first place. What is infertility? When would you say that a couple is infertile? Well, infertility is defined as the inability of a couple to achieve conception after 1 year of regular, unprotected intercourse. So the key word there is what? The duration, which is 1 year. They're having regular intercourse and it's unprotected. So if you have the man staying in Germany and the wife is staying in Lagos, and they only meet twice or once in a year, you can't say that that couple has infertility because they've not met regularly. Or if a couple is using protection because they don't want to get pregnant soon and you're not aware, then you can't say that they have infertility. So regular, when we say regular, we meet 3 to 4 times weekly, unprotected intercourse. If you have had that for 1 year and there is no conception, then you say, okay, there's infertility. Yeah. You can actually reduce that duration to 6 months if the woman is 35 years and above. Because why? At 35 years, that is a watershed. The fertility of the woman drops significantly. So you don't have to wait for 1 year before you start taking steps. So for a woman who is 35 and above, after 6 months of regular unprotected intercourse, you can say that we can begin to investigate. All right. Sometimes you may not even wait at all. Once there's already a known factor, there's already a known issue. All right. Even before the couple came together, before they got married, you can actually begin the process of evaluation and treatment as soon as possible. So, what are the causes of infertility? So, it's important for us to know that they are divided into both male and female factors. Next slide. All right. And we can say that 30% of the time it could be due to the male, 30% female, and then combined factor 30%. And then the remaining 10% will be due to what we call unexplained infertility, meaning that this couple has gone through the routine evaluation and there's no definite factor that has been attributed to as a cause of the infertility. All right. And so the next slide is we'll be looking at the male factor infertility. When we say male factor infertility, we're looking at all those causes that impact on the sperm parameters. It has to do with the sperm. It has to do with the sperm. Now, there are parameters that determine whether the semen parameters are okay or not. All right, and I'll quickly just go through that. When you are evaluating the sperm, there are 3 factors that you look at specifically. Number 1 is the sperm count. Number 2 is the motility. And number 3 is the morphology, whether they have normal form sperm cells or not. Now, according to the WHO, the count should be 15% and above. 15 million, sorry, 15 million and above is considered as normal sperm count. So if it's less than 15 million, then that is abnormal. So from 10 million to 15 million is considered as mild low sperm count. 5 to 10 million is considered as moderate low sperm count, and 5 million and below is considered as severe low sperm count or oligospermia. Now we come to the motility. The motility talks about the movement of the sperm. There's no use having so much sperm and they are not moving, because you need the sperm to move to achieve fertilization. So in terms of the sperm motility, rapid motility should be at least 32% and above, and then the total motility should be 40% and above. That is considered normal. And then for the morphology, it should be at least 4% and above. Now, once you have those parameters in the positive, then you say that the sperm parameters are okay. But if it's not, then it's abnormal. All right. So, what are the causes of male infertility? What causes this abnormality in the sperm parameters? There are a lot of factors to consider. So, we'll quickly just go through them. Lifestyle factors: alcohol consumption, smoking, and drug, cocaine, marijuana. All of these all have impact in lowering the sperm count. All right. And then you have the what we call the etiologic factors. And these are factors that you cannot identify them. You can't say this is what is causing it. We cannot pick one factor and say this factor is what the reason why these semen parameters are very poor. So they're called idiopathic factors. And it's better for us to know that these idiopathic factors make 50%, but 50% of all sperm abnormalities, semen parameters being abnormal is caused by idiopathic factors. And then, of course, you have other factors like undescended testes. When the testes refuse to descend into the scrotum and is present in the abdomen, if this is not detected on time, it can actually lead to sterility, when the testes will be completely destroyed and sperm will not be produced. Then again, you have infection of the testes, otitis. All right, it can cause abnormalities in the sperm production, varicocele, the presence of the abnormal veins that take blood away from the testes and the scrotum. If they become engorged, it can cause a reduction in the sperm production. Why? Because there will be an increase in the core temperature. For sperm production to take place, the temperature must be less, at least 1 degree less than what is found in the body. And that is why the testes are found not inside the body, but outside the body in the scrotum. Why? Because that environment creates an enabling environment for sperm production to take place. And then you have trauma. If the testes gets traumatized for whatever reason, that definitely will lead to abnormalities. And then surgery, angiography, prostatectomy, any of those surgeries that can lead to the damage of the vas deferens can definitely lead to abnormalities with the semen parameters. And then chemotherapy and radiotherapy for treatment of cancer. The chemotherapy, those those drugs are very toxic, and so they can stop sperm production, and of course, also radiotherapy. And then genetic factors, Klinefelter syndrome, SXY, all of these can lead to abnormalities in sperm production. So these are some of the causes of male infertility. And then we go quickly into the female factors. All right. The female factors are again divided broadly into about 5 factors. You have the ovulatory factor, tuber factor, uterine factor, cervical, and the pelvic factors. Ovulatory factors are factors that will prevent the woman from ovulating. Normally, a woman should ovulate every month. Ovulation means the release of eggs from the ovary. So the woman should release one egg from the ovary every month. So anything that prevents that from happening will definitely prevent her from getting pregnant. And so what are these factors that prevents ovulation? One of the common factors that prevents ovulation is what we call PCOS, polycystic ovarian disease syndrome. And what that means is that you have a polycystic ovary, a lot of follicles, but yet no egg is being released from them. And then you also will have associated with that what we call hyperandrogenism, meaning that the woman has a lot of high levels of androgens and will lead to the abnormal hair distribution. All right. And then this woman often will have irregular periods, and sometimes some of them may be obese. So it is this syndrome that usually characterizes and is the leading factor of anovulation. And then you have high prolactin, and then you have thyroid disease, and then you have hypothalamic hypogonadism. All of these will cause a woman not to ovulate every month. And then we go to the tuber factor. Anything that damages the tubes, because fertilization occurs in the tube, in the ampulla region. So what that means is that sperm will need to travel from the vagina where it is deposited through the cervix, through the uterus, into the tube, travel through the tube towards the distal end and the ampulla region. And it's expected that at ovulation, egg should have been released from the ovary and get into the fimbra. Those are the finger-like projections that would collect the egg and move it through the tube into the ampulla region. So anything that prevents this from happening, like damage to the tubes, would cause infertility. So things like infection, pelvic inflammatory disease, STDs, any infection that affects the tubes will cause damage. Also surgeries. A woman who has had surgery, myomectomy, cystectomy, cesarean section, any surgery that an ectopic pregnancy for a woman who has an ectopic means pregnancy occurring outside the womb that led to the tube being removed, or endometriosis. All of these factors can cause tuber damage and will lead to infertility. And then we go on to the uterine factor. Uterine factor such as uterine syncytial, endometrial polyp, endometritis as infection affecting the inner lining of the womb, or submucous fibroids. All of these are all factors that can prevent pregnancy from occurring. And what we do is to ensure that we sort out these challenges before the woman can now go on to get pregnant. Because if what these factors do is that they prevent implantation. Uterine syncytial means that the wall of the uterus of the endometrium, they've come together, completely obliterating the endometrial cavity where the baby should implant. Polyp means that there is a growth in the endometrium, and that is where the baby should grow. And then, of course, submucous fibroid also means that there's a fibroid that is in the submucous layer. And all of these will affect conception. Then cervical factors, antibodies that fight against the embryos and prevent them from growing. Cervical stenosis means that the cervix is completely blocked. And then, of course, infection. And then pelvic factors will include endometriosis and, of course, also infection. All of these will go on to affect. There are female factors that will prevent a woman from achieving conception. So when a woman comes and she goes through these evaluations, what we want to do is to assess and find out what is causing the couple from achieving conception. And once we have discovered that, then we go on to manage, all right, treat causes that can be treated, and then we go ahead and provide treatment. All right. So if you ask me now, if I ask you who is to blame for a couple inability to achieve conception, I will say that there's nobody to blame. The causes can either be male or female, or both of them together. Okay? So we go quickly to the next fertility issue, which again is very common, and that is, I'm above 50 years. What are my chances? Why is this common? Because we are seeing a lot of couples who are coming at an advanced age. At an advanced age. If we take the statistics and we look at the age of women who are coming in for fertility care, I'll probably say that more than half of them are in their 40s and above. Late 30s into their 40s and above. So age is a major factor that affects fertility. Definitely. Age is a major factor. So as a couple gets older, particularly for the woman, fertility decreases. Now, what is the significant age? What is that age that really makes all the difference? That age is 35. 35 years. A woman peaks, her fertility peaks around the age of 28, 25, 28. By the time she gets to 30, it plateaus, all right? And then it begins to decrease slightly by the time she gets into her early 30s. By the time she gets to 35, there's a significant drop. And then by the time she gets into her late 30s, into 40, it begins to really go down. So when you see a woman who is in her 40s, getting into her 40s, there has been a significant drop in her fertility. And that can really affect her chances, both for natural conception and for assisted conception. The question to ask, is that the same for the man? Well, not exactly. The men are a bit on the lucky side. You begin to experience some changes in the man's sperm parameters that is affected by age by the time the man gets to about 60. So you say, oh, that's not fair. Well, that is nature. That is the way God did it. And that is why you can see a man that is 70 years still scoring goals. All right? But for a woman, age is a major factor. And that is why women don't have all the time. That's why there is an age for reproduction to take place. So that is why this question becomes very important. I'm 50 years old. I've probably even stopped menstruating. I've entered into menopause. Do I have a chance of getting pregnant? To answer that question, I will say that a woman who is 50 years old, who is expecting to get pregnant using her own eggs, the chance of conception is virtually non-existent. Why? The reason is because at 50, most likely your eggs have been exhausted. A lot of women who are at 50, they've already have entered into menopause. And menopause means that you've stopped menstruating, at least for 1 year. And the reason why you will stop menstruating is because